Welcome to this plenary session. Before we begin, I want to set out a few points. This meeting will be held in a hybrid format with some members in the Senedd chambers and other chamber and others joining by video conference. All members participating in Senedd proceedings, wherever they may be, will be treated equitably. A plenary meeting held using video conference in accordance with the standing orders of the Welsh Parliament constitutes Senedd proceedings for the purposes of the Government of Wales Act 2006. Some of the provisions of Standing Order 34 will apply for today's plenary meeting, and these are set out on your agenda. I would remind members that standing orders relating to order in plenary meetings apply to this meeting and apply equally to members in the chamber as to those joining virtually. So our first item this afternoon is questions to the First Minister, and the first question is from Hefin David.
Will the First Minister make a statement on the impact of the Health Protection Coronavirus Restrictions No. 4 Wales Regulations 2020 in Caerphilly?
Sorry, thank the member for that question. The intended impact of the regulations in Caerphilly is to arrest and reduce the prevalence of coronavirus from its current rising and elevated level of 447 people per 100,000 in the population, and to reverse the rise in positivity rates from its present level in Caerphilly of over 17%.
I'd like to pay tribute again to the people of Caerphilly, and many of whom are keeping in touch with me about the issues that they are facing as a result of these very difficult times. And I'm so often in awe of the measures that people in Caerphilly are taking in order to control and contain the virus. Several constituents have been in touch with me with regard to relatives in care homes, many of whom are suffering from dementia and are currently prevented from visiting those relatives because of Caerphilly County Borough Council policy. We've queried this with Caerphilly Council, who told us that measures are put in place to prepare care homes for resumption of indoor visits, but they are awaiting a letter from the Welsh Government confirming a change in guidance. Now, as I understand it, the Welsh Government guidance is clear, and therefore I'm looking for the First Minister to help me with this and find a way through what seems to be a blockage of bureaucracy in order to assist people in visiting relatives in care homes. I'd also say, while mentioning that the pilot lateral flow device and pods to enable visiting are to be welcomed, and particularly where visitors can now use these facilities to visit relatives in care homes, balancing against that risk of COVID. But in this particular case, could the First Minister provide some support for me to get it back to Caerphilly Council and enable those visits to resume where safe and possible?
So I thank Kevin David for that, and he points to one of the acutest dilemmas in the whole coronavirus pandemic, and that is the need for relatives to be able to visit people in care homes and yet the extreme vulnerability of the care home population. So the Welsh Government has provided regular guidance throughout the pandemic, both from the Director of Social Services in the Welsh Government, Albert Heaney, and through the Minister, Julie Morgan. Our guidance, I think, is clear. We say to local authorities that it is important to avoid an unnecessarily restrictive blanket approach to visiting, that it needs to be calibrated in the individual circumstances faced by the local authority, but also faced by the care home itself. Obviously, nobody would wish to see visits to a care home if the care home itself is actively dealing with an outbreak of coronavirus amongst its population. But we're still in a position where almost half care homes in Wales have not had a single case of coronavirus. The lateral flow device experiment, which is going on in Wales at the moment, will help to allow more visits to take place. But I want to emphasise the fact that here in Wales, all the other precautions that we would expect to see, the wearing of PPE, the maintaining of social distancing, the special measures the care homes have put in place, we'd still expect to see all of that happening, even if someone has tested negative through a lateral flow device. And the 30 pods to which Evan David referred, they are now provided. They'll be available for Christmas, and I know that my colleague Julie Morgan hopes to have something to say very soon on support for those providers who've been able to source their own visitor pods, again in an effort to allow visits to take place where that balance between the need for human contact with family members and the balance with the prevalence of the virus can be properly struck.
Laura Ann Jones.
Thank you, Gareth. First Minister, we all recognise that that cases are rising across South East Wales and Wales, and the seriousness of that, and that public health and safety must come first. But do you recognise the anger and frustration of businesses across Wales that have made great efforts to ensure the safety of their customers, only to be punished by these latest government damaging restrictions? Brain spent 500,000 on PPE, ensuring to protect and showing its commitment to protect its customers. Will you agree to publish the data in the interest of transparency so people can see the evidence on which these decisions were made?
Well, Llywydd, I'm afraid the Conservative Party in Wales is in a disgraceful position in relation to this matter, and that disgrace was very well illustrated in the member's question to me. In the face of the numbers that we see here in Wales, the grip of the coronavirus crisis in Wales, she consistently, as does her party, avoids their responsibility for facing up to that and wants instead to make ridiculous allegations about sectors of the economy being punished in Wales. That sector is receiving £340 million worth of support from the Welsh Government, where her party in Westminster is providing £40 million for the whole of England. Here in Wales, we work with the sector. We do our very best to be able to help them to deal with the consequences of this emergency. But this is a public health emergency, and it's time the Conservative Party in Wales really did recognise that.
Elith Jewell.
The First Minister and his colleagues have had to make extremely difficult decisions during the pandemic, and all of us are alive to how serious the situation is now in Caerphilly and across the South East. I've just listened to the exchange between you and Laura Ann Jones, First Minister. I think there is a disconnect between the severity of the situation and some public attitudes towards this. I wonder if this might have been because of some breakdowns in communication. I feel that the restrictions that have just been talked about with the hospitality sector, which came in last Friday, they could have been met with less resistance if there'd been a longer lead-in time, which would have allowed businesses time to plan in terms of both staffing and stock, because failure to allow that time led to businesses having to close at short notice and pour beer down the drain. I'm aware of one business, which is in Caerphilly County, that sent a message to members saying that they'd taken the difficult decision to suspend some services until mid-January because they had no confidence in the government's ability to commit to a reliable schedule of releasing restraints to promised deadlines. So could I ask, First Minister, what assurance could you provide to the hospitality sector that you'll give them as much time as possible to prepare in future, both in terms of lifting and imposing restrictions?
Well, I announced on a Friday that these changes would be coming into place on the following Friday. When a government is provided with advice from its chief medical officer and others that action needs to be taken, and that the speed at which that action is taken will have a direct impact on the effectiveness of those measures and the impact on people's lives, I think it is incumbent on government to act as soon as reasonably can be on that evidence. And the longer you wait, the more lives are lost. So it's a terribly difficult balancing act between giving businesses the time they need, and I recognise the points the member made are absolutely fair in that regard. But the balance is between allowing those businesses to prepare against the certain knowledge that every day without the restrictions is a day less to have an impact on the coronavirus pandemic that we face. Now, we provided a full week of advance notice. On the following Monday, we provided all the detail of what would be required. I don't deny for a minute that is a short period of time for businesses to be able to react. But we did give them what I thought was the longest we could, consistent with the advice we received, that action was needed, it was needed as soon as possible, and that every day we delayed meant the coronavirus was going to get worse and the impact on our health service on people's lives would be worse as well.
Question 2, Jack Sargent.
Diolch Llywydd. How is the Welsh Government adopting a trauma-based approach to developing a kinder public services?
Thank Jack Sargeant Llywydd for that. The adoption of a trauma-based approach in Wales is primarily taken forward through the work of the Adverse Childhood Experiences Hub. It works to embed the principles of trauma-based practice across the range of key public services in Wales.
Can I thank the First Minister for that answer? And members will be aware, as my ongoing commitment to bring a kinder politics here to Wales, they will be aware that I have previously called for kinder public services, services that recognise individual circumstances and do not take a prescriptive one-size-fits-all approach. First Minister, I wanted to share with you today a positive. The Welsh, with the support of the Aceh Hub, have developed a trauma-informed rehabilitation programme, which has seen fantastic results. It is helping individuals who have suffered multiple adverse childhood experiences to turn their life around, and it also helps break the generational offending cycle. This is good for both service users and the taxpayer. First Minister, will you join me in praising this trauma-based approach and commit to continue to support the Aceh Hub to help provide kinder human services?
Well, Llywydd, thank Jack Sargeant for bringing us a piece of good news to celebrate on the floor of the Senedd this afternoon. I think I had read that he had himself met recently with the Welsh to hear of their work and the way in which they are using the trauma-informed approach that has been pioneered through the ACE Hub to make a difference in their work. I know that Jack Sargeant will know that our blueprints, our female offending and youth offending blueprints, are based on a trauma-informed approach to putting right in the lives of people things that have gone wrong much earlier in their lives. And his call for a kinder public service, which I've heard him speak here eloquently on the floor of the Senedd to support. He will have seen, I'm sure, that the toolkit that the Hub has recently published to help workers make the link between physical and mental health and to recognise the signs and symptoms of trauma, that it starts by saying showing kindness, compassion and listening can be protective factors for those who have experienced adversity. So kindness, which is a quality worth pursuing in itself, also has that practical advantage of making a difference in the lives of people. And I'm very pleased to join with Jack Sargeant in marking and celebrating the work of the Welsh and all those others whose work has been informed by the work of the Centre, and he will know that my colleague Julie Morgan has committed £250,000 to make sure that the work of the Hub goes on into the next financial year while we review all the work that is going on in Wales in this area.
Susie Davies.
Diolch yn fawr, Llywydd. Well, First Minister, of course, the pandemic's been a challenging time for very many, including pupils and students. All will have seen an impact on their learning, but some will have seen some on their mental health as well, as we've all heard over the last few months. For some, of course, it will be temporary, hopefully, but for others, it could trigger something far deeper and more long-lasting. So, First Minister, can you tell me who's responsible for ensuring that schools and colleges become trauma-informed, and how many of the schools and colleges in South Wales West have had access to an ACE ambassador from the ACE Hub? Thank you.
Well, I can't give the member a specific figure for her own area. I can tell her that through the ACE Hub, comprehensive training has been provided to over 600 schools in Wales, and that the work of the ambassadors has been fundamental to that. The member will know that we have increased the funding for school counselling services, and that school counsellors are also part of the group of public sector workers who are informed by the work of the ACE Hub, as are youth workers and housing workers and all health visitors here in Wales. The extra funding, therefore, that we have placed into school counselling draws on that work, allows more help to be given to a wider range of ages in our school system and more young people who have. Susie Davies says, and was reinforced to me in a meeting that I held with the Youth Parliament, chaired by the Llywydd only last week, that the impact on the sense of well-being and mental health of young people in Wales in the pandemic has been profound and will be with us, I'm afraid, not just while the pandemic itself last, but there will be a recovery period that will go on well beyond that.
Questions now from the party leaders. Plaid Cymru leader Adam Price.
First Minister, a study recently published by researchers at the London School of Hygiene and Tropical Medicine has found that mass testing in Slovakia, which we've discussed before, coupled with other measures, additional support for people self-isolating, brought the infection rate down by 60%, which is considerably higher than the impact of the recent lockdown, for example, the circuit breaker in England. The study found that due to the nature of the test used in Slovakia, they probably picked up 90% of the people who were tested and were infected in that time, whereas in Liverpool, the evidence there suggests that rapid tests have missed 50% of all infections and 30% of those with a high viral load. The Technical Advisory Cell advice published today says that while there are new technologies that will enable more rapid testing, they're not a silver bullet. But TAC's advice predates this new evidence that I've referred to. So can you ask TAC to look again and undertake modelling to assess the likely impact of a Slovak-style mass testing programme in Wales as a more effective means of suppressing the virus and an alternative to cycling in and out of higher restrictions?
I was very happy to ask the Technical Advisory Group to do that. They, in any case, constantly update their advice based on emerging evidence, and particularly emerging evidence that is reported in reputable scientific journals of the sort to which Adam Price referred. We have our mass testing programme still going ahead in Merthyr Tydfil, expanded, as the member will know, into the Cynon Valley over the weekend. We're learning a lot ourselves from doing it. I think it's quite important, Llywydd, to make a distinction between those lateral flow devices that we are using, which essentially pick up people who are infectious to others. So they pick up people a couple of days before symptoms begin, and they continue to pick up people who are infectious for about 5 days or so beyond that. The PCR tests pick up not people who are infectious, but people who are both infectious and infected. And you can be infected for up to 8 weeks beyond the point at which you were infectious to anybody else. PCR tests pick up the very last remnants of coronavirus that still may be circulating in somebody's system. So it's important to be clear about what the purpose of the test is. And I remain sure myself that the lateral flow devices that we are using in Wales have a part to play, provided it is carefully understood and properly calibrated.
Thank you for that, First Minister. In the TAC advice that I just referred to, they do say that a period of pre-isolation for families with children as a result of school closures could reduce the level of social mixing ahead of the 23rd to 28th December period, and therefore have a beneficial effect in terms of saving lives. Are you considering this as an option, First Minister? And if you are, could you say when you would plan on announcing it? And what mitigating measures would you put in place in the form of blended learning, the continued operation of hub schools, for example, to minimise wider harms? I mean, would you agree that it's essential that no child's education or wider welfare should be unfairly disadvantaged as a result of this? And can you give an assurance that key workers in the NHS and other sectors shouldn't be put in the invidious position of having to choose between turning up for work or looking after their children during this period?
So the final points that Adam Price made are exactly why I want very strongly to endorse today the joint statement made between the Welsh Government and the Welsh Local Government Association that urges schools to remain open till the last day of term, while recognising that there will be individual sets of circumstances where that will not be possible. Of course, Mr Price is right. I brought the document with me this afternoon, expecting it would be referred to here, that a period of restraint for 10 days before the Christmas period would be to the advantage of all families. The real problem is is that we do not have confidence from the behavioural evidence that if children are not in school, that they would simply be kept at home and kept away from the contacts that would otherwise create greater risk. The fear is that children who are not in school will be in even riskier environments. I know Adam Price will be interested that in the mass testing of schools in Merthyr, the positivity rate, remember we tested every child in secondary schools there, was less than 1%. So far lower than the positivity rate in the general population, suggesting that being in school is actually very safe for children and young people. If I thought that those young people would genuinely be at home, genuinely self-isolating, genuinely creating that period before Christmas to keep them safe, I'd be attracted to the idea. I'm afraid the risks are that that simply wouldn't happen, that those children would be doing riskier things than they would in school. Better for them to be in school, particularly I agree with the points that Adam Price made towards the end about the need for vulnerable children to continue to be offered an education right up to the end of school term, and for the children of key workers to be offered that service as well.
Just to be clear, so in terms of the pre-isolation point then, will the Welsh Government be giving wider advice to families in relation of a pre-isolation period? Finally, on Monday, your colleague, the Health Minister, warned that further restrictions may be necessary in response to the rising level of cases. A few weeks previously, the Deputy Minister for the Economy also said a second firebreak in the new year would be likely. And looking forward, I mean, the TAC report does also emphasise the importance of maintaining public support, because otherwise that could lead to lower levels of adherence in the public. And the advice says that ideally the policy and the rules need to be simple, understandable and achievable, accompanied by a clear rationale with an agreed beginning and end. Would you accept, First Minister, that in some people's minds there is a lack of clarity at the moment as to where we are headed between now and the spring? What is the strategy for regaining control, reopening eventually, and then recovery? And isn't now the time, First Minister, in light of the changing situation, that the Welsh Government presents a new winter plan?
Well, we're at a strange cusp, aren't we, in the career of coronavirus. We have today people being vaccinated for the very first time here in Wales and across the United Kingdom. We have, we hope, the prospect of a further vaccine being considered now by the regulators. We hope that it will gain regulatory approval, and that will give us another string in the bow that we need. But at the same time, in the immediate position, we have a very difficult position in Wales. All local authorities but one in Wales today show rising numbers. We have authorities in Wales with over 600 and over 500 per 100,000 people who are infected with the virus, and positivity rates of 25% in some parts of Wales. These are incredibly serious figures. Members here will have seen that last week the Welsh Ambulance Service had to declare a major incident one day, particularly in the south-east of Wales, because our hospitals are so full of people already suffering from the virus that they weren't able to get help to people in the way that we would want to see, in the timely way we would want to see for other serious conditions. I agree with Adam Price about the struggle to secure public consent for some of the measures that are necessary. And I hope we won't have to rely on people seeing for themselves the fact that the health service isn't able to do what we need it to do before people understand the urgent need for action. We go on trying to explain that every day to people, that the measures we take are simply proportionate to the scale of the difficulty we face, that we have to act together, each one of us in our own lives, to do the right things that will bring the virus under control. And then we will have a path into next year which is different, that will allow us to use the lateral flow devices, the mass testing, the vaccination, that will give us a different 2021 to the year we are in. In the meantime, nobody should underestimate the seriousness of the position that we are facing in Wales.
Arweinydd Ceidwadwyr Paul Davies.
Diolch, Llywydd. First Minister, when you announced the firebreak lockdown in October, you said that this was our best chance of regaining control of the virus and avoiding a much longer and much more damaging national lockdown. However, yesterday it was confirmed that Wales was the only part of the UK where figures were not falling at the end of November. First Minister, before considering introducing any further restrictions, can you tell us what assessments have been carried out in relation to the Welsh Government's firebreak lockdown, given that figures haven't fallen in Wales compared to other parts of the UK?
Well, Llywydd, assessments have been made of the firebreak period, a period, of course, which his party refused to support here in the Senedd. It was successful. Those 17 days did put the career of coronavirus back 3 weeks earlier than the 23rd of October. It suppressed the R number here in Wales for a 3-week period. It did what we had hoped that it would do. The problems we have faced have been in the post-firebreak period, where the virus has circulated faster and further than the modelling would have suggested, and hence the need to take further action again now.
Well, First Minister, we know that infection rates in Wales are 70% higher than when we entered the firebreak in October, and rates have increased by 82% since the end of the firebreak lockdown. Indeed, the fact is that there are now more than 1,800 coronavirus-related patients in hospitals across Wales, which is the highest number since the pandemic began, and it shows that something has seriously gone wrong. And we know that there is still an issue in hospital settings, and clearly more work needs to be done to tackle hospital-acquired infections. And there's also concerns over transmission rates in household settings, which you as a government have been saying throughout this pandemic, of course. Now, yesterday, as has already been said, the Health Minister also warned that the Welsh Government would be looking at whether further measures would be needed to suppress this virus, but the Health Minister refused to provide any further details to the people of Wales on what those restrictions would look like and whether they would be concentrated on specific sectors and environments and whether they would be nationwide restrictions. Therefore, will the First Minister confirm exactly what further measures are now being considered? And is the Welsh Government looking at further restrictions before the Christmas period restrictions, or is the intention to bring in further measures post-Christmas?
Well, so with all those facts and figures that the Leader of the Opposition began with are the facts and figures that I put to him last week when he refused to support the measures we took in relation to hospitality, measures which this week I think nobody could possibly deny were right and necessary. Now, we need to give those measures an opportunity to make a difference. We need them to be accompanied by actions that people can take in their own lives to assist communities right across Wales to get this virus back, the numbers falling once again. I don't think that means that we will be taking further measures this side of Christmas. But the other side of Christmas, the advice in the TAC report published and referred to by Adam Price is clear on this as well. That a period of relaxation over Christmas will lead to a further rise, yet a further rise beyond the figures that the member set out in his further question to me. And that means any responsible government has to think about the measures that might be needed in order to protect the health service so it can go on doing everything else. It has to do at the most pressurised point in any year and to prevent avoidable deaths. I look forward, Llywydd, I look forward to the support of the Conservative Party here in Wales for measures that will be necessary, because up until now, that support has been conspicuous by its absence.
Not true, First Minister, because because the fact of the matter is this side of the chamber have actually supported the majority of your coronavirus regulations that have actually been tabled since the end of March. So it's not true to say that we haven't supported your coronavirus regulations on the whole. But what the people of Wales need now, First Minister, is hope. Hope at the end of what has been a very difficult year. Now, today marks a landmark moment as coronavirus vaccinations begin to be rolled out in Wales. And I'm pleased that a four-nation approach across the UK has been able to procure vaccines for all parts of the country. Now, I understand that the UK has ordered 40 million doses of the Pfizer vaccine, and as a result, Wales will have 40,000 doses of the vaccine, which equates to enough for nearly 20,000 people across the country. Of course, it's incredibly important that there is sufficient capacity in the NHS to roll out the vaccine effectively and as part of making capacity and resources available. I hope the Welsh Government has considered the role that community pharmacists and perhaps even retired clinicians can play in helping administer the vaccine across Wales as smoothly as possible. So, First Minister, can you tell us what strategic discussions are taking place with health boards across Wales to ensure that there is sufficient capacity and staff available to roll out the vaccine effectively? Can you also tell us what discussions are taking place with retired clinicians and indeed other medical professionals about the role that they could play in helping with the rollout? And has the Welsh Government had any discussions with community pharmacists about the role they could play in administering the vaccine in communities right across Wales?
Well, let me end this part of our proceedings by agreeing with the Leader of the Opposition that this is a moment where hope is really important to people. This has been such a long and difficult year in the lives of so many people here in Wales, and today, when the vaccine is being used for the first time, it does give us that glimmer of light at the end of what is still a long tunnel in front of us. The fact that we have been able to agree all this on a four-nation basis is something that I am very keen to welcome. Was very pleased to be part of the agreement on how the vaccine should be distributed. I know my colleague Vaughan Gethin has met the other health ministers on a weekly basis right through November and met again yesterday to make sure that we have a common sense of what this vaccine can do, how it can best be deployed, in the 40,000 doses that we are getting from the first batch of the vaccine is our population share of it. Now, we've been part of planning on this since June of this year, when the first All Wales Programme Board was set up for vaccination, and we are, I believe, as well prepared for it as we could be. I agree that as the volume of vaccination grows, we will need to draw more people into the pool of people able to carry out vaccination. All health boards have plans to recruit people into that pool to make sure that they are properly trained, that they're properly accredited, and that their work is supervised by experienced clinicians. As it happens, I also know that my colleague, the Health Minister, is meeting Community Pharmacy Wales next week, so there will definitely be opportunities to talk about the contribution that community pharmacy can make in this field. But the level of preparation we have in Wales, the commitment that has been shown by existing staff who've come forward to offer their services as vaccinators, I think can add to that sense of hope that we can offer people here in Wales today that next year will be a different year to the one that we've all experienced in 2020.
Question 3, Carwyn Jones.
I was remuted by the powers that be there, but will the First Minister make a statement on access to dentistry during the COVID-19 pandemic?
Thank you, Karen Jones, for that. We continue to implement a safe, phased re-establishment of dental services. The majority of dental practices now provide a full range of treatments for patients in Wales. COVID-19 required public health measures, however, remain necessary. Safety considerations mean that fewer patients can be treated in any one clinical session.
I thank the First Minister for his response. Does the First Minister share my concerns that the rhetoric, naivety and sheer ineptitude of the Brexiteers in the UK government will make it far more difficult for us to recruit dentists and other staff for public services during this pandemic and beyond.
Well, thank Karen Jones for that supplementary question. He's absolutely right. In dentistry, 17% of all dentists currently registered with the General Dental Council come from Europe. That percentage is higher in the larger corporate companies who supply a large percentage of dental services. It's estimated that dentists who are recruited from the European Union provide as much as 30% of all NHS dental treatment here in Wales, and those people have already stopped coming, Llywydd. That is the point, isn't it? They don't believe that they will be welcome in the United Kingdom of the sort that Mr Reckless would wish to devise. He'd rather they weren't here, and they hear that message from him. And as a result, they have stopped coming. They have no certainty over their employment. They have no certainty over their residence. They face the declining value of the pound as a result of the way that Brexit has been navigated by this government. I think I referred last time, Llywydd, to a meeting that I attended, led by the then First Minister. It was in his office with the First Secretary of State for leaving the European Union, David Davis. The then First Minister put a series of really important points to the Secretary of State about the Irish border, about Welsh ports, about the recruitment of public services. Carwyn Jones, in his supplementary question, referred to ineptitude and naivety. While it was fully on display that day, we were told that this would be the easiest negotiation that we had ever entered into, that the United Kingdom knew what we were doing, and those foreigners would fall apart as soon as we put our demands on the table. How wrong he turned out to be.
Darren Miller.
Thank you, Presiding Officer. First Minister, the issue of dentistry is a very hot topic in the Clwyd West constituency at the moment as a result of an announcement by the Bupa Dental Care that they're going to be closing their clinic in Colwyn Bay. That's going to affect around 12,000 people in my constituency, and they've been advised by the local health board that they should seek to register with other NHS dentists in the North Wales area. Having contacted those dentists, they're told that they're not taking on extra patients. I heard what you said in response to Carwyn Jones's questions, but the reality is that you should have been training more dentists over the past decades. You shouldn't be having to rely on dentists coming in from overseas. If we'd have trained sufficient numbers, and you've been responsible for workforce planning for the past 20 years, then we wouldn't be in the pickle that we're currently in with a shortage of dentists across Wales. Now, I've asked to meet with your Health Minister and the Chief Dental Officer to discuss the situation in Colwyn Bay, and they've refused to accept my request for a meeting. So can you tell me, what action is your government taking to make sure that we've got sufficient numbers of dentists being trained in Wales now to meet the future needs of the Welsh population? And how can you reassure people in Colwyn Bay that they'll have access to NHS dental services as and when they need them in the future?
Well, the pickle we're in, as the member put it, is because of the advice that he and people like him gave to people in Wales, that we would leave the European Union. They'd see no disadvantages at all in their lives. And yet what they're finding out is that his advice and the advice of people in his party has led to the position that they are facing in Colwyn Bay today, where a large corporate body, previously able to provide those services, is no longer able to attract the staff that are needed. And that's a serious position in North Wales, as Sian Gwenllian explored with me here only 2 weeks ago. I explained then the actions that the Health Board are taking, the dental teaching unit that's to be established in Bangor that will attract further staff into the area, the work of the Deputy Chief Medical Officer, Professor Paul Broadhurst, in providing advice directly to the Health Board. I disagree with what Darren Miller said about the future for dentistry. The future is not in relying entirely on more dentists. It is broadening the dental profession. It is making better use of other members of the dental team and making sure that those high-volume activities that dentists need to be carried out can be carried out by people who are trained to do so, but do not need the very long training and the very scarce expertise that dentists themselves represent.
Thank
you, Llywydd. I have to say that I'm concerned that there's been a lack of planning in dentistry and ensuring that that service is sustainable for the future. I'm truly concerned about the position of dentistry in my constituency. Closure of private dental surgeries on the mainland recently has further exacerbated the problems people have in registering with and finding a dentist that does NHS work. The steps that I've taken along with the dentist in Anglesey to increase capacity has faced one barrier after the next, having already managed to attract 2 dentists in, but failing to get the board to increase the contract. In addition to that, I have huge concerns about what's happening to specialist dental services in Ysbyty Gwynedd, the loss of services and a failure to recruit, making me think that there is a plan to downgrade services. So can we have a full review of dental services in my constituency and indeed in broader North West Wales?
Well, Llywydd, I agree with Rhyn ap Iorwerth about the problems facing people in the north and the north west and the northeast, and it also goes to the root of the problems that I have explained this afternoon, and I will speak to the Minister to see whether there are more details that we can give members and be clear with people about the steps that the Health Board in North Wales is taking to try and address the problems that they are facing at present.
Griffiths.
What is the First Minister's current assessment of COVID-19 incidents in Wales?
Thanks, John Griffiths. The incidents in Wales, represented by the 7-day rolling average, has been increasing each day for the last 18 days. Unless this trend can be halted and reversed, we will see an exponential growth in coronavirus right across Wales.
First Minister, it is a very worrying situation, and among the factors involved that make it very worrying is the increasing emergence of long COVID, which I believe the health service unfortunately may be dealing with for some years to come. Months after contracting the virus, sufferers are left with a range of symptoms, including breathlessness, brain fog, pain, and fatigue. It is debilitating for many, and fears are growing that it could go on to affect hundreds of thousands across the UK. In England, they are opening specialist clinics to treat long COVID, and in Scotland, they are funding rapid research projects and working up new treatment guidelines. First Minister, I would be grateful for your advice on Welsh Government action to address this significant threat to the health of our nation.
Thanks, John Griffiths, for that important supplementary question, Llywydd. We have 1,100 people with confirmed coronavirus in Welsh hospital beds today. Over a quarter of them will need to be in hospital for 3 weeks or longer. This is a virus from which rapid recovery is not the outcome for many, many people who contract it. And not only does that mean that more and more people are retained in hospital beds, but that there is a long aftermath for many people. I know that John Griffiths will be aware that the Health Minister published a written statement on this on the 23rd of October. We published our National Framework for Rehabilitation from Coronavirus in May of this year. Our focus is on trying to provide services for those people suffering the long-term effects of coronavirus as close to home as possible. It's not a model that relies upon people who are already unwell and suffering from those effects having to make their way into a hospital setting in order to get the treatment that they need. So we are looking to have multidisciplinary teams that operate in the community and only where absolutely necessary from inpatient rehabilitation services. That's a different model to the one that's being adopted in some other places, but we think it will provide a better service to more people more conveniently and more attuned to the nature of the impact from coronavirus that they are suffering. In relation to clinical trials and research, then we are ourselves, just as Scotland are, involved in a number of different studies. We're participating in the development by NICE of a clinical definition of long COVID, which will help with its diagnosis and its care. And we're participating, Llywyd, in the UK post-hospitalisation COVID-19 study. That's a study funded by the National Institute for Health Research and the Medical Research Council at a UK level. It involves 10,000 participants, and it's been described as a world-leading study in informing the developments of those care pathways that will be needed to help patients recover as fully as possible and as quickly as possible, having experienced the deeply debilitating impact of the disease.
Question 5, Janet Finch-Saunders.
Sorry, there was a delay on the unmuting. Thank you. Will the First Minister make a statement on the impact of the review of the Health Protection Coronavirus Regulation Restrictions number 4 Wales Regulations 2020 on Conwy County?
So the impact of the revised regulations will be to allow continued travel between Conwy County and other parts of Wales. The regulations will help save lives of Conwy citizens, which would otherwise be lost, while safeguarding the local health service. The regulations will next be reviewed on the 17th of December.
Thank you, First Minister. Now, of course, I have had to raise concerns on this because between the 28th of November and the 4th of December, Conwy had 62.3 cases per 100,000. Obviously, compared that with Neathport Talbot of 621.7, 10 times more severe than Conwy County. Now, according to the latest COVID-19 bi-weekly local authority review report published last week, the rate per 100,000 amongst those aged 60 or older in Conwy was 26.9. Now, had we have had a tiered system in place, as in England, Conwy would be in Tier 1. So how do you address and will you act on the hundreds of calls from both constituents and those in business for a Welsh tiered system? And can you explain how it is even considered balanced or proportionate for Conwy to be subjected to the same regs as Neathport Talbot? And my final point is, lots of those in the hospitality industry are very concerned now as to the restrictions between the 17th of December and over the Christmas period as to whether they will be able to trade as normal and serve alcohol with their food. So did I hear you correctly earlier that these restrictions will be lifted on the 17th, allowing the hospitality businesses and pubs and restaurants and things to be able to go back to business as normal? Thank you.
Some of the members certainly did not hear me say that the restrictions would be lifted on the 17th of December. I said that they would be reviewed on the 17th of December, and that review will have to take into account that the figure in Conwy today is 73.4 people for every 100,000, and that would absolutely certainly not put Conwy in Tier 1 in anybody's system. And that figure, not only is it 73.4, Llywyd, but it is rising every day. Over 120 people have lost their lives in the member's constituency as a result of coronavirus. The positivity rate in her local authority area is over 5% today. This government will be focused on the public health emergency and why the actions we are taking will save lives in Conway and every other part of Wales. I won't be focused, as the member is, on other and, in that context, more peripheral issues. The Conservative Party needs, the leader of the opposition seemed to imply that this is already where the Conservative Party was. But in fact, today, all the questions I've received from his backbenchers have not been about coronavirus at all. It's been about the hospitality industry, as though that were the more important of the two issues. And it happened again in the supplementary question from Janice Finch-Saunders. The position in her constituency, is getting worse by the day. That's what she needs to recognise, and it would be very good indeed to have her support on behalf of her constituents for the measures that are necessary to protect their lives.
Cwestiwn 6, David Rees.
Diolch, Llywydd. What action is the Welsh Government taking to support families who are told to self-isolate?
Llywydd, in addition to existing support for families, we have introduced a self-isolation support scheme, making £500 payments to people at risk of financial hardship because they are self-isolating. This scheme is now being extended to include parents and carers of children who have been asked to self-isolate.
Can I thank the First Minister for that answer and for the decision of the Welsh Government to expand the self-isolation support fund to parents, because that's clearly one of the concerns many have raised with me and my constituency, as many children have been asked to self-isolate within their schools, and single parents in particular are facing challenging times in delivering that. Can you confirm to me that that fund will work on a multi-occasional basis? Because many parents, including my own grandchild, has been sent home more than once from the school, who are told to self-isolate. So it is important that they're aware of that. But can you also work with the campaign that the Welsh Government is leading with the TUC on asking employees to know their rights and responsibilities, and expand that to work with employers to know that their responsibilities, and in situations where we see parents having to take time off, or maybe on more than one occasion, employers act in a responsible and compassionate manner to ensure that those parents are entitled and reminded that they can return to work and their work is not at risk. But can they also ensure that if the employers decide to ask someone to stay home because of coronavirus, they also act responsibly to ensure that those individuals are financially supported by the employer?
So we thank David Rees for those important points. We discussed these matters at the last meeting of the Social Partnership Council with representatives of employers in the private and the public sector, as well as trade unions were present. I'm very glad that the campaign that we have launched and are running at the moment is one supported by the CBI and the FSB, as well as the Wales TUC, and it's there to make sure that employers as well as workers know and then live up to their responsibilities. So the reason why we've extended self-isolation payments to parents and carers of children have been rehearsed on the floor here at the Senedd. I think Helen Mary Jones raised it with me last week. But also, the more coronavirus is in circulation, the more people will be asked to self-isolate. In South Wales Police alone, 350 staff and police officers have been asked to self-isolate in the last 7 days. That is the impact of coronavirus in our communities and on our key public services. It is why it is absolutely essential and unambiguous that we have to take the actions that we are taking. And where people try to chip away at it, looking for restrictions to be lifted, acting as though restrictions are not necessary for the health of the public, that sort of figure simply tells you that unless we get this under control and act together to do it, the impact is absolutely real, not just in the health service, but in other public services as well. David Rees asked how many times it's possible to claim a payment. I think we allow it at the moment on 3 different occasions. If a setting has needed to ask people to self-isolate for 3 times in a row, then we think it is right to pause and find out what is going on in that setting. Because in the way that David Rees said, sometimes we need to put the cause of the problem right in a workplace, rather than always just dealing with the consequences.
Cwestiwn 7, David Rowlands.
Llywydd. Will the First Minister make a statement on future funding for Cardiff Airport in light of the impact of COVID-19?
Thank the member for the question. Llywydd, COVID-19 has been a very challenging experience for Cardiff Airport and the whole aviation sector. While we continue to support the airport funding, options are constrained by state aid rules and by the continuing uncertainty surrounding any Brexit deal.
I thank the First Minister for that answer. The Welsh Government made a brave decision when it bought Cardiff Airport. That decision appeared to be vindicated given the performance of the airport in the years leading up to the COVID crisis. Despite some opposition in this chamber, I believe that a truly international quality airport is a significant, even vital ingredient if we are to call ourselves a global nation. Given the confidence the industry shows in Cardiff Airport, expressed only last week by the low-cost carrier Wizz announcing to use the airport on a long-term basis, and the return of Ryanair pre-COVID, not to mention the airport's old friend KLM, would the First Minister commit to ensuring the funds and/or helpful interventions will continue for the airport until such time as, and I'm sure this will happen, the government is able to profitably sell its share in this vital asset?
Well, shall we thank David Rowlands for his consistent support for the airport and for drawing attention this afternoon to the very welcome announcement last week that there are to be 9 new routes out of the airport provided through Wizz Air. 3,500 seats will be available, 40 direct jobs and 250 indirect jobs supported by that new announcement. I have met myself officials regularly with the Transport Minister Ken Skates and with the airport authorities over this crisis to try to make sure we are doing everything we can to continue to support them. We are constrained, Llywydd, by the interpretation by the UK Government of state aid rules. In other EU states, including France and Germany, policies permit support for safety and security measures to be what's called allowable aid for state aid purposes. The UK Government doesn't allow that. That constrains our ability to provide help to the airport, which is just fair help, help that allows them to compete on a level playing field with what is available elsewhere in Europe. It will be a great help to us if the UK Government would review its position on that matter, and it would be a particular help to us in the state aid notification for COVID-19 damage, which we have launched with the European Commission and which we hope will be of help in allowing us to provide further support to the airport in this difficult time so that it is there to resume its successful recovery, as we saw since it came into public ownership in 2013.
Ac yn ola, cwestiwn 8, Dawn Bowden.
Will the First Minister provide an update on the rollout of the COVID-19 vaccine in Merthyr Tydfil and Rumney?
Thank Dawn Bowden for that. Plans are in place for Cwm Taf Morgannwg University Health Board to deploy the vaccine immediately, in line with the vaccine delivery schedule and the advice from the Joint Committee on Vaccinations and Immunisations.
Thank you for that answer, First Minister. And before I move on to the vaccine, can I once again thank those that were involved with the huge logistical challenge of the mass testing pilot in Merthyr Tydfil. The tests so far have identified some 22,000 or more asymptomatic people through the testing programme, with around 280 positive cases identified, people who will now not be in the community spreading the virus. So we believe that that's around 50% of the eligible population, and in my view that shows a great success that this pilot has been. But as we move on to the vaccine rollout, I wanted to stress the importance of past learning in healthcare, and that the rollout of the vaccine is that we need to avoid what we often refer to as the inverse care law. Now, while it's right that we prioritise frontline health and care staff and vulnerable citizens across the country in the first waves of the vaccinations, will then move on to the general population. And I hope there is a recognition that those areas, like my constituency, that have been hardest hit by COVID, both in terms of the number of cases, but also the economic impact, will require special attention in the vaccine programme. So can you confirm that this has been considered by Welsh Government plans for the vaccine rollout, and that you will ensure that the programme will not fall foul of the inverse care law?
Shall I thank John Bowden for that? Can I as well thank all those who've been involved in that fantastic effort in Merthyr on the mass testing front, but also this afternoon, Llywydd, particularly to thank all those people in our health service who have been part of the vaccination programme, the huge work that has gone on very rapidly over recent weeks to provide the logistical support, the transport, the storage, the onward provision of the vaccine, and today we see the fruits of that. And I'm sure everybody in the chamber and remotely today would want to thank those who've made that possible. Thank John Bowden for raising that important point about the inverse care law. She will know that vaccination is one of the relatively rare parts in the health world which has the opposite characteristics to the inverse care law. I remember when I was the health minister and the member represented workers in the health service, we introduced the HPV vaccine for young women aged 14 and above. The highest take-up in the whole of Wales was in Merthyr Tydfil. The lowest take-up of all was in Merthyr, in Monmouthshire. And strangely, those figures persist to today. Monmouthshire has a take-up of HPV of 77%, and Cwm Taf Morgannwg has a 91% take-up. So vaccination is one of those relatively rare things where the inverse care law doesn't seem to apply. And it's really important it doesn't apply in relation to this vaccine. And the fact that the JCVI schedule for the rollout of the vaccine focuses on age and clinical vulnerability means I think that its impact will most be felt most quickly in those parts of Wales where we have higher concentrations of older, poorer and sicker populations. And that means, I hope, that we will see greater numbers of those populations, including the constituency represented by Dawn Bowden. They will see the benefit of this vaccine first. And given the characteristics and given the advice of the JCVI, so they should.
Diolch i'r Prif Weinidog.
Thank you, First Minister. The next item is the business statement and announcement.